I'm going to show you how to relax your own back and neck a little bit and show you some techniques that can relieve tight and achy forearms. And these are just 2 short and easy cranial techniques. I'll show you how you can use them on yourself, and they're so simple that you'll be able to take them home and back to the clinic and use them with your patients if you'd like. But for starters, let's take a look at the fact that we're going to talk about the midline of the body. When we talk about the midline of the body, we're going to talk about little stretching strokes. I'll show you a picture in a minute. So my strokes are really, really, really small. Probably most of you have almost never done a stroke this small. It's like ½ an inch. What this does, seemingly, is enable a stretching of the skin and superficial fascia. This is no deep tissue work, but it's not, it's not super soft. It's not like a spa treatment, really. It's more than a Swedish stroke, but it's so short that it actually apparently is stretching the tissue and engaging the nerves that are called mechanoreceptors. They're the nerves that respond to a mechanical change in their environment. And in this case, the mechanical change is a very small stretch. So this is Pat. Pat is a character with spine. This is C1. Right up here, like right between your eyebrows, that's C1 in my book. I've given lots of things new names. And here we go. Cervical spine, thoracic spine, and then down through the lumbars and down to the sacrum. And the sacrum's down here at the occiput. So I'm going to have you start here because it feels nice. And when you're doing it on yourself, you can just use 2 or 3 of your middle fingers and just sit there and gently start with your fingertips touching and then spread gently apart like ½ an inch. 1001. Move them up a tad. 1001. Move them up again. 1001. Keep going up your forehead. 1001. And where your hair is, or hair should be, or used to be, keep on going. 1001. And when you get up there on the top, maybe you'll want to use all 4 and 4 fingers together. Put them together, spread them. 1001. Move them back just a little bit, not very much. 1001. Move them back a teeny bit more. 1001. 1001. 1001. 1001. A slow stretch. You want to be engaging the scalp. You're not just sliding around on your hair. You're engaging the scalp and giving the scalp a little bit of stretch. And you get back here, about where that bumpy point is back here, past that little dip that we call abelian. Get back there to where lambda is. And then you can work your way back forward again. 1001. 1001. Obviously, we're doing it here with our elbows up in the air because we're sitting in a classroom of chairs. When you're at home or at your office, the great way to do it is to sit at your desk or a table where you can rest your elbows on the table and do it this way. It's more relaxing for your arms. It's more relaxing for your spine. It's a really nice way to relax your spine. You can do it in about 2 minutes, going from the front to the back and the back to the front. It's a really nice way of calming and quieting a patient. In the forehead especially, it really seems to be very relaxing. If I've got a patient, especially a new patient that's come in, they're kind of like nervous-y and kind of jittery, and you can tell they're really not very calm and not at ease about being there too much, and they're not quite sure. I think, I'm just going to give you a little massage on your head for a minute. And I just start here, and I'll just go up into the hairline, maybe just a tad. But I'll just bend, and I'll go back and forth over it maybe 2 or 3 times. It's really a very nice quieting effect. You can also use it on kids. You can use it on your spouse if you need to, if you want to, if you can get away with it. Hey, sometimes whatever works.